Now that you've had a chance to review the information about the novel coronavirus, which causes the condition called COVID-19, and what all members of the general public need to do in order to keep themselves and each other safe, let's start our foray into the world of a healthcare provider during this pandemic. In this brief module, we will be covering the difference between COVID screening and testing. Screening can be done when there are large numbers of people entering buildings such as our own. It's not foolproof, as a number of people who've contracted COVID-19 never demonstrated a fever. Coronavirus testing, on the other hand, comes in many different forms. The most common form that you've probably seen is the nasopharyngeal swab. This looks like a Q-tip going into the nostril of the patient, while the healthcare provider is wearing appropriate personal protective equipment, as shown on the image in the right. The purpose of testing is to confirm whether or not the person being tested actually has the virus. Screening helps to determine if there is a person under investigation, that is, someone who has symptoms that probably ought to be tested. Another main point that we need to think about is that not all who have COVID actually have a fever, and not all who have a fever have COVID. So you can see some of the limitations of the screening process. To confirm that a patient actually has COVID, a nasopharyngeal swab test is the most accurate. A large number of other tests are being developed and are available. For now, this is the gold standard. In the absence of a testing, even with our screening protocols to enter our building, we still need to assume that everyone is an asymptomatic carrier. What that means is that we still need to take precautions. We need to wear a mask, socially distance, and make sure that we clean our hands on a regular basis. At UTSD, we have a 3-tiered screening system for our patients. The first tier occurs by phone before the patient arrives for his or her appointment. This includes a series of COVID-19 screening questions. Tier 2 occurs at the building entrance when the patient is again asked the same screening questions and in addition has a temperature check. Tier 3 occurs chairside by the clinician as part of the health history review.